Welcome in, everybody, to a deep dive on a topic that sparks a lot of curiosity
Yeah.
and, honestly, maybe a little apprehension, too.
Yeah, definitely apprehension.
I'm talking about electroconvulsive therapy, or ECT.
ECT, it can feel like a mystery. We've all seen the intense, portrayals in movies, but what's the reality, you
Yeah.
know? So today, let's unpack what ECT is, how it's used, and we're going to be using two sources to kind of guide our exploration here. One from HealthWise, which is a resource for healthcare professionals, and the other from Medline Plus, which is designed for the general public.
Perfect. Okay, so let's dive right into it. What exactly is ECT? Both sources talk about a controlled seizure being induced, but how does that actually work?
Well, while a patient is under anesthesia, a brief electrical current is sent to the brain, and I think it's really important to emphasize that because of the anesthesia and muscle relaxants, there aren't any physical convulsions like you might imagine.
That is a really important distinction. It's not this, dramatic scene that we often see depicted, but it does make you wonder, if there's no dramatic physical reaction, how does it actually work?
Right, that's a great question, and honestly, it's one that researchers are still exploring. The precise mechanisms are still being investigated, but it's believed that ECT leads to changes in brain chemistry, similar to how medications work.
So it's almost like we're still figuring out the why behind the what.
Exactly, and that just speaks to the complexity of the brain, doesn't it?
For sure.
But even without knowing all those intricate details, we do know that ECT can be an effective treatment option, especially for certain conditions.
That leads us to our next question. When is ECT actually used? Both sources point to severe depression as the primary reason.
Right. And the HealthWise source goes into a little bit more depth, mentioning that ECT might be used in cases where someone is experiencing delusions or hallucinations, or when there's a risk of suicidal thoughts. Those are situations where rapid intervention is really critical.
Yeah, and Medline Plus expands on that a bit, mentioning mania, catatonia, and psychosis that aren't responding to other treatments. So it seems like ECT is often considered when other approaches just haven't been successful.
Yeah, that's a really important point to make. It highlights the fact that ECT is generally not the first line of treatment, but rather a potential option when other approaches have either been exhausted or just aren't suitable.
Now I think it's time to address the elephant in the room, the potential risks and benefits of ECT. I imagine a lot of listeners have questions, especially about memory.
Absolutely. Memory concerns are probably the most common worry people have when it comes to ECT.
And for good reason, right? I mean, it's the thing you always hear about.
Right. It's true that some temporary confusion and short-term memory loss are common side effects after the procedure. But what's really interesting is that advancements in ECT techniques have made long-term memory problems much less common than they used to be.
Okay, so it's not the memory erasing procedure that it's sometimes portrayed to be.
Not at all. Those concerns were more prevalent in the past, but modern ECT procedures are significantly safer and more refined.
Medline Plus even mentions the possibility of unilateral ECT, where the electrical current is applied to only one side of the brain.
Yeah.
What's the rationale behind that?
Well, researchers believe that unilateral ECT might further reduce cognitive side effects, including those related to memory, compared to the traditional bilateral approach.
That makes sense. So while there's still the possibility of side effects, it seems like the medical community is constantly looking for ways to improve the safety and efficacy of ECT.
Absolutely. And like any medical procedure, it's crucial to have a thorough discussion with your doctor about the potential risks and benefits, in your specific situation.
Speaking of which, let's talk about the decision-making process. Both sources are very clear that deciding to undergo ECT is a very personal decision, and it should always involve a conversation with a healthcare professional.
Right. It's not a decision to be taken lightly. It's about having an open and honest conversation with your doctor, considering all the treatment options and weighing the potential risks and benefits based on your individual circumstances.
And it's important to remember that it's perfectly okay to ask questions and seek second opinions if you need to. You have the right to be an informed patient and make choices that you feel comfortable with.
Exactly. Being actively involved in your healthcare is so crucial. So before we move on, let's take a moment to kind of recap what we've talked about so far. We've learned what ECT is. We've explored the conditions it's typically used for, and we touched upon the potential risks and benefits.
And I think this is a good time to step back a bit and delve into the history of ECT. It's had a pretty complex journey, hasn't it?
Oh, it has, definitely. ECT was first introduced in the 1930s, and the early procedures were, frankly, quite different from what we see today.
Yeah, the Medline Plus source mentions that the amount of electricity used has been drastically reduced over time. That must have made a huge difference in terms of side effects.
Absolutely. In the early days, the electrical currents used were much higher, and that contributed to a higher risk of side effects, particularly memory problems. So thankfully, research and technological advancements have led to much safer and more refined procedures.
And the introduction of anesthesia and muscle relaxants must have been a game changer as well.
Without a doubt, those innovations made the experience much more humane for patients. Imagine undergoing a procedure like that without anesthesia. It would be incredibly traumatic.
Yeah, it's amazing how far we've come in terms of patient care and, finding more effective and ethical treatment approaches.
Speaking of ethics, I think it's important to acknowledge that there have been and continue to be, ethical considerations surrounding the use of ECT.
It's a treatment that's often sparked debate and controversy, right?
Yeah, and one of the key ethical concerns is the issue of informed consent. It's crucial that patients fully understand the procedure, its potential risks and benefits, and any alternative treatment options that are available to them before making a decision.
That makes perfect sense. Patients need to be able to make an informed choice, free from any coercion or pressure.
Exactly. And another ethical consideration is the potential for misuse or overuse of ECT. It's important to emphasize that ECT should only be considered as a last resort when other treatments haven't been successful or aren't suitable.
Yeah, it seems like it's all about finding the right balance, tailoring treatment to each individual's needs and circumstances, and ensuring that ethical guidelines are strictly followed.
Precisely, it's about responsible and compassionate care.
Despite the advancements in ethical guidelines, it seems like ECT still carries a certain stigma. Why do you think that is?
I think a lot of it stems from how ECT has been portrayed in movies and TV shows. Those often sensationalized depictions can perpetuate negative stereotypes and misconceptions.
It's like that image of the dramatic convulsion is seared into our collective memory, even though that's not the reality of modern ECT.
Right, we need to separate fact from fiction. While ECT can have side effects, as we discussed earlier, it can also be a life-saving treatment for people struggling with severe mental illness who haven't found relief through other means.
So it sounds like what we need is more open and honest conversations about the realities of ECT, both the potential risks and the benefits.
I agree, we need to move beyond the fear and the stigma and focus on providing accurate and balanced information.
As we're talking about this, I'm wondering about the long-term effects of ECT. Our sources touched on memory, but are there other long-term considerations?
That's a great question, and one of the most common concerns, as we've mentioned, is the potential for long-term memory loss.
And that's certainly understandable. Memory is such a precious part of who we are.
Absolutely. But research suggests that while some people may experience some memory gaps, particularly around the time of the treatments, most people regain their memories over time.
So it's not necessarily a permanent loss.
Not typically, and as we discussed, advancements in ECT techniques have significantly reduced the risk of lasting memory problems.
That's reassuring to hear, but I imagine it's still something that's carefully monitored and discussed with patients.
Of course, it's part of that open and honest conversation we were talking about earlier. And it's also important to remember that untreated severe depression can have its own devastating effects on cognitive function and overall well-being.
That's a really important point. Sometimes the potential risk of a treatment have to be weighed against the very real risks of not treating a serious condition.
Exactly. It's a complex issue with no easy answers, and it underscores the importance of individualized treatment decisions.
So it's not a one-size-fits-all approach. Each person's situation is unique, and treatment plans need to be tailored accordingly.
Precisely. It's about personalized medicine and finding the best possible path for each individual.
One thing that strikes me is the role of research in continuing to improve ECT. It seems like there's always something new being discovered.
Research is absolutely essential in this field. Ongoing studies are exploring new techniques, refining protocols, and investigating the long-term effects of ECT.
That's reassuring to know that there's a constant effort to improve patient outcomes and minimize any potential risks.
It's about staying at the forefront of knowledge and using that knowledge to provide the best possible care.
So as we wrap up this part of our deep dive, I think it's clear that ECT is a multifaceted topic with a rich history and a promising future.
It's a treatment that deserves to be understood, discussed openly, and approached with a balance of caution and optimism.
And in our final segment, we'll explore some of the emerging trends in ECT research and the future directions of this often misunderstood treatment. Stay tuned. Welcome back to our final segment here on this deep dive into ECT. We've covered the history, the ethics, the risks, the benefits, but where is all this heading? What about the future?
That's a really fascinating question. And, I think one of the most exciting areas of research right now is the development of more targeted and personalized approaches to ECT.
Okay, so we talked a bit about unilateral ECT earlier, where the electrical current is applied to just one side of the brain. Is that kind of what you're referring to?
Yeah, that's one example, but researchers are also exploring even more precise ways to deliver that electrical stimulation. They're looking at different electrode placements, different stimulation parameters, all with the goal of maximizing the therapeutic benefits, but while also minimizing those side effects.
So it's about fine-tuning the treatment to each individual's needs and brain structure.
Exactly. It's like we're moving away from that one-size-fits-all approach to something that's much more tailored and personalized.
That makes a lot of sense. Are there any other promising research avenues that you're particularly excited about?
Well, the use of brain imaging techniques like MRI and PE scans is opening up a whole new world of possibilities.
Yeah, those scans allow us to see what's happening in the brain in real time, right?
Yes, and that is incredibly valuable because it lets researchers observe how ECT affects brain activity. They can see which areas are being stimulated, how those areas communicate with each other, and how those changes relate to symptom relief.
Wow. So we're finally getting a glimpse into the black box of ECT.
Exactly. And the insights that we're gaining are helping us refine those treatment protocols and potentially even predict which patients are most likely to respond well to ECT.
That could be huge in terms of personalized medicine.
It really could. And, brain imaging is also helping us better understand the long-term effects of ECT on brain structure and function.
Right. And that brings us back to those long-term effects. We've talked a bit about memory, but are there other areas that researchers are focusing on?
There's growing interest in exploring the role of ECT in preventing relapse. Traditionally, ECT involves a series of treatments followed by maintenance sessions, but researchers are now investigating whether extending those courses of treatment or using novel maintenance strategies could lead to, more durable remission.
So it's not just about treating the acute symptoms, but about finding ways to provide lasting relief and prevent those symptoms from recurring.
Exactly, and that's especially important for individuals with severe and recurrent mental illness who often struggle with those cycles of remission and relapse.
It sounds like research is constantly pushing the boundaries of what we know about ECT. What do you think the future holds for this treatment?
I think the future is incredibly bright as we continue to unravel the mysteries of the brain and develop those new technologies. I wouldn't be surprised to see even more innovative approaches to ECT emerge. We might see new stimulation techniques, personalized treatment protocols based on individual brain mapping, or even the development of non-invasive alternatives to ECT.
Wow, that's incredible to think about. So as we wrap up this deep dive into electroconvulsive therapy, I think it's safe to say that this is a field that's constantly evolving and full of potential.
I completely agree. ECT has come a long way from its controversial beginnings and continues to be refined and improved through ongoing research. And while it's not a cure-all and it does carry potential risks, it remains a really valuable tool in the treatment of severe mental illness for those who haven't found relief through other means.
Well said. And we hope this deep dive has given you a more nuanced and informed understanding of ECT.
Absolutely. And we encourage you to continue learning about this complex and evolving treatment.
Thank you so much for joining us. And until next time, keep those brains buzzing.